Hello, I'm Bill LeMay, and thank you for watching Community Matters. We hope you'll continue to watch as we discuss issues facing our community and provide you with the resources and information needed to find solutions. Hospice care is a specialized type of health care focused on providing comfort and support to terminally ill patients and their families. It shifts the focus from curing the illness to managing pain and symptoms, aiming to improve the patient's quality of life in their final months. Hospice care also offers emotional, social, and spiritual support to both the patient and their loved ones. Joining us now from Transitions Life Care, Dr. Rachel Lipner, Chief Medical Officer. Doctor, it's great to have you on the program.
Thank you so much for having me.
Boy, this is, I've gone through this personally, so this, I think, is going to be one of the best programs for people who are eventually going to have to go through this themselves. And we're talking about hospice care. Tell us a little bit about your organization.
Yeah, I think hospice and end-of-life illness touches everyone, so honored to be part of the program. Transitions Life Care was founded originally in 1979 as Hospice of Wake County. It was developed and created by Dr. Billy Dunlap, who is a local physician in the area who proudly still sits on our board, so we're very much rooted in the community. We've grown over the years and changed our name from Hospice of Wake County to Transitions Life Care. Obviously, the core of what we do is hospice care, but we've really tried to meet the needs of the community and add additional supports further upstream, serious illnesses, palliative care, words that may sound familiar but don't have a lot of reference to that our team has the specialty to help support patients with.
Well, did you say 45, 46 years?
46 years.
A lot has got to have changed since you first opened the doors. What are some of the things now today that you offer that weren't even available back then?
Yeah, so over the years, we've added an inpatient hospice unit. So our patients who are very, very sick, needing high-level symptom management support can be in. So we have a 30-bed inpatient hospice unit. We've also added, like I said, our serious illness service program, which captures people before they're at a place of a terminal illness, where we can add physician, nurse practitioner, social work, nurse support before they get to a stage where they are needing hospice care. That piece is essential to our community because, as we've talked about with a lot of our patients, navigating the healthcare system can be so complicated. So having a team that can kind of wrap around them and talk through what's going on with them medically, support more than just their physical body, but their emotional well-being is really what we pride ourselves in.
Well, I know a lot of folks may go into the hospital with a serious illness, and let's say it's cancer, for instance, and they may see somebody in palliative care initially. What's the difference between palliative care and hospice?
Great question. I like to think about palliative care as a bigger circle, more diverse circle, and hospice is kind of the center bullet of it. So palliative care is really designed to support people with a life-changing or life-threatening illness. Like I said, interdisciplinary team support, supporting patient and family, guiding through the serious illness process. So we have patients we see with palliative care support who are still pursuing disease-targeted treatments like surgeries, chemotherapy, and our team walks the way with symptom management support, psychological support, all of those pieces, even if the goal is still restorative treatment.
Well, another big part of this is the loved ones, the family members who are trying to go through this with their loved one, and most people, unless you're a medical doctor, really don't understand what's going on. How important is your service to them?
It's essential. I can't tell you the number of times I or my team has met with a family and a patient and explained just what sort of support and really explanation of what's happening is going to, our palliative care team and hospice team is going to add to the services, and you can literally see the weight of the world lift off their shoulders. Because the healthcare system is excellent, it does amazing things, but when things get really complicated, you have multiple doctors, different specialties involved, it can get very complicated very fast. And we pride ourselves in taking the time to really educate our patients and families about their disease trajectory, their options. The goal is to have them be autonomous in their decision making. So really we honor them and their goals with the plan of care we create.
Now, I know there's a lot of dementia, for instance, Parkinson's. There's a lot of diseases that take quite a while actually to progress, but that doesn't mean you shouldn't at least explore hospice? I mean, you offer services outside your facility, I assume. How does that work?
Yeah, so the majority of the patients we take care of are in the community. People think of our inpatient hospice as the hospice location, but truly our patients, palliative care, hospice, dementia care are seen in the community. We go to our patients where they are because as you get sicker, it's hard to go to a doctor's appointment. It's harder to be able to get to locations, and being in your home gives back the control to the patient and family who are otherwise feeling sometimes lost in the medical system. When it comes to dementia, especially, it's a very progressive, slow disease process that we find caregivers, especially family members, need a lot of support with. And that is something we pride ourselves in having an entire service line, a dementia care service line to help support them. Social work support, provider support as needed. That's something that we're very proud of. We are involved in a CMS innovative pilot program called the GUIDE model that really is increasing caregiver support to our patients when they still have many years left to live, but the caregiver burden is really high.
What is the ultimate goal or mission, I should say? And I know everybody's an individual. Is it, in the past, it was just to, I thought, was to make the transition from this life to the other as comfortable as possible. But I get the feeling it's a heck of a lot more than that.
It's to meet our patients and families where they are and to provide really a wraparound service line of support for people who have serious illness, life-threatening illness. I always joke, some of our patients get better and they don't need our services anymore, and that's a win. So we want to be with our patients and families through the illness and the complications. If it ends up being an end-of-life situation, we surely have the support to manage that. But we want to get these conversations started earlier. I can tell you from personal experience, I've had so many really hard conversations in an ICU waiting room when there's been no conversations had prior. And if I can take away the suffering that I've seen when there haven't been discussions ahead of time, that's really what we're trying to do, is move the services earlier to our entire patient population.
When is that conversation initiated? I mean, does the family reach out? Does the doctor reach out? When do you know to call you?
All the above.
Okay.
And I always tell people, if you're thinking about us, you should have called us months ago because we could have been supporting you months ago. Not to blame anyone, but just saying people don't realize how soon they can get our services involved. So I say at time of diagnosis of a life-changing illness, or if there's questions or concerns from a caregiver support team, we want to be that resource for people. We really, there's not a situation where we won't take a call and give guidance and ensure that if it's not us that can be the ones to help, that we can get people connected with the right resources.
Is there an initial assessment of the patient?
Yeah, so we have an incredible care navigation team that does phone call assessments, and then we determine what service line is likely to be most appropriate for our patient and family, and then the assessment is either done via telehealth or in person, depending on exactly what service they're going to fall into.
So if someone's watching right now and they have any questions at all, what's the best way to get a hold of you?
Best way is either to call our main office number or to go through our website. We have a really easy process to submit for referrals. And again, you don't even have to know what you need. You just either call or submit through there, and someone will give you a call back and connect to try to figure out how we can best help support.
Doctor, I appreciate you being here. What you do is so important, incredibly important. Don't you go anywhere, because we're coming back right after the break.